I'd like to extend a huge thank you for everybody coming and spending a Friday evening with me to talk about one of my passions, which is helping people. I'd like to give you just a quick introduction of who I am. My name is Kevin Lucas, and I've been practicing the wealth method of structural integration for 12 years, as well as teaching for the last 12 years. I started off as a massage therapist, and upon finishing my massage program, we transitioned into my structural integration training and have been going strong with that ever since. It's a huge passion of mine to share this information. My specialty, my clinic, I'm the owner of Balanced Life Center, which is a collaborative care wellness clinic where we have acupuncture, massage therapy, structural integration, dietary information, and it's a phenomenal way to be able to offer people an insight on what's going on. As many of you guys know, as you're all in the wellness field as massage therapists, that people are having a hard time, and especially with chronic pain, we're seeing people taking so many steps to try to help themselves, but still struggling with not getting better for the long term. So my specialty with patients are people who ran the gamut. They've had chiropractic care, physical therapy, they've had surgery, they've been on medications. Oftentimes they've had a great amount of massage therapy to be left not fully satisfied with where they're at in regards to their health improving. I specialize in dealing with neurological disorders such as dystonia, post-polio, Parkinson's. And what we find is that with the method that we utilize with our patients, people who've been struggling with chronic pain for years, decades, oftentimes, are able to get a very quick improvement in a very short duration of time, especially with the technique and the method that we're going to talk about tonight. The next thing that I would like to do is I would like to start off with some recognition. The biggest thing in acknowledging our ability to be able to be with people and be in relationship with people is recognizing those relationships. And we, as massage therapists, hold very special relationships with our patients. Think about it. The person going to the doctor that spends 5 minutes with their doctor, if they're lucky, people seeing even chiropractors oftentimes, which is an amazing process to the wellness toolbox. They don't get as much time with them as we do. We're spending an hour once a week, sometimes 2 or 3 times a week for, we have a lot of patients who've been receiving massage therapy for years. So we get to hold a very special relationship with our patients and our clients. So I want to thank you guys for being here. It's a Friday evening. You guys could be out on the town having a great night and having a good time. And you've chosen to take some time to spend with me this evening talking about the world of massage therapy and how we can better help our patients. So congratulations to you. One of my teachers consistently says successful people are willing to do the things that the other guys and gals are not. And the fact that you guys are here with me tonight, making those steps in the right direction. The other piece that I would like to give huge recognition to is my beautiful bride. Cassandra is the one that does all the behind-the-scenes work. I get to do the fun part of getting to talk with you guys, my students, as well as working with my patients, and she does everything else. She's the webmaster, the technical guru, and I just want to thank her for allowing me to be able to live my passion. So recognition aside, what are we going to talk about tonight? The technique that we're going to talk about, or the concept that we're going to talk about, is where it is, it isn't. And what does that mean? I want you to take out a pen and paper. Hopefully you guys are obviously by your computers, and you have some writing utensils, because I'm going to want you to take notes tonight. There's going to be some very valuable nuggets of information. You're going to be able to watch this recording again if you choose to on the website, but there's something special to writing notes and taking notes. We, on average, use 8,000 neural pathways when we're writing something down, and that allows our brain to be able to assimilate and absorb the information in a very different way than if we're just listening or if we're typing notes on a computer. So what I want you to write down right now is, what are the most common areas of pain that you experience or your patients experience when they come to you and they're seeking therapy? Obviously, we have a huge gamut, huge area that people can choose, but there's some consistent spots that people experience chronic pain. They're stretching, they're walking, they're working out, they're changing their diets, and then they're still struggling. So as you write that down, if you think about all of the patients you see in a day, in a week, in a month, What are the most common areas that those patients tell you that they're having the hardest time? So many of my patients, we see chronic neck pain, chronic back pain in the thoracic area, low back pain, as well as hip pain. Knee pain and ankle pain definitely kind of jump in there, but the upper cervical region and the lumbar region tends to be the areas where we see a very significant amount of chronic pain. When people are talking about the thoracic area, oftentimes they make note that it kind of comes and goes throughout the day depending on how stressed they are, what their workload is. But when we're talking about the cervical spine and the lumbar spine, it's very common that those are areas that kind of stay with us all day long. When they go to bed, they still notice their low back, or they still notice the neck when they're sleeping and when they wake up. So what are those chronic areas of pain that your clients experience? So that being said, the next question that I want to ask you is, what is the difference between pain and symptoms? This is going to be a big key that we're going to need to talk about tonight, and this is something that we should all be talking with our patients about, because quite frankly, most of our patients don't really have a solid understanding of how their bodies work. And so what we say, it's very similar to automobiles. Most of us, we can take the key, we can put it in the ignition, start the car, and we can drive the car, but how many of us really know the intricacies of what's happening within our vehicle? And what we find is that people who know a little bit, they can change the tires, they can add air, they can add oil, they can change their own oil. And that would be someone who's exercising, someone who's eating okay. But when it comes to dealing with chronic long-term pain, what we find is that very few people really have a good understanding of what's actually going on in their body. And so they come to us as the therapists looking for help, and they say, oh, I'm hurting, my shoulder's hurting, my low back is hurting, my hips are hurting, and what they ask oftentimes is, can you please work on my shoulder? Can you work on my hip? Can you work on the area that's hurting? Now, there's some benefit to this, but is the patient then, after your treatment, experiencing long-term consistent relief from what you just did, or within 2 or 3 days are they right back to having the same problem again, and then the next month, and then the next year, and then we're going on to decades? And as many, in the poll that we did earlier, we saw we had quite a few practitioners that have been practicing for a good 8 to 20 years. So you guys know, you've seen people that have been dealing with pain issues for a very, very, very long time. So what is happening with their pain versus their symptoms? Can people differentiate? I'm feeling a little achy, or I'm feeling a burning sensation. Oftentimes people have a hard time even quantifying what it is that they're experiencing. They say, oh, my shoulder hurts. Now when we ask them where in their shoulder, they say, oh, just my shoulder, my shoulder. Is it the clavicle? Is it the sternum? Is it the scapula? Is it the glenohumeral joint? Is it the attachment of the deltoid? Is it the rotator cuff? Oftentimes people get very misguided when it comes to what is actually going on and where they're hurting. So then they go and they seek therapy, and they can get good therapy, but the next week they could be right back to square one. So we really need to start understanding the concept and the difference of where the pain is, what the symptoms are, and where the pain and the symptoms are actually coming from. And that's what we're going to talk about. Where it is, it isn't. So when a patient comes to you and says, my shoulders are hurting, my back is hurting, my neck is hurting, does that mean that that is the problem, or does that mean that that's the symptom? Here's an indicator for you. If they're coming back to you week after week after week for months and years and decades, and you've been working on where they say they're experiencing pain, which is absolute truth, right? We're not going to tell them that they're not hurting there. What we find is that if you're working the right areas, why is it that they're having the same problems over and over and over? They feel better for a couple of days, maybe even a couple of weeks, but they're right back to square one. A common statement that we hear in our clinic, especially with new patients, is, oh, I was seeing a massage therapist, and if I didn't get my massage on Friday, I was going to be miserable for the whole weekend, and if it wasn't for my massage therapist, I'm going to have a hard time. Or if I don't get my chiropractic adjustment, I'm not going to be able to have a good week at all. And what that's doing is that's putting all of it, it's taking all of the accountability for what they have going on in their bodies and putting that responsibility on somebody else. And what we're finding is that as a result of that, we're dealing with a very significant amount of chronic pain that just isn't going away, or it's just not being managed. If I'm watering a plant and I'm trying to take care of a plant and it needs a certain thing, such as water and sunshine, but I put in Red Bull, I put in tea, I put in Coke, I put in all of these other things, Pepsi and Mountain Dew, and it's dying, I'm not going to question what am I doing wrong. I'm going to know, oh, I'm putting things in the plant that aren't supposed to be there. People oftentimes don't apply those same concepts to their bodies. So they're going and they're getting, good therapy, but they're not getting better, and they don't ask the question, man, what's going on? Why is it that I'm not seeing consistent improvements, and why isn't it that improvement isn't holding? Really good chiropractors, really good PTs and massage therapists will be the first one that will say things aren't really changing, and I think we need to find another avenue. And that's why having a good referral source helps. But again, where is the pain coming from, and what are the problems? So I want you to think about when you're working with your patients, do your patients have the understanding of the difference between their symptoms and their pain? And then the next step is that what is the problem? So when my patients come to me and they say, my shoulder hurts, my back hurts, we take that into consideration, but for me, that's not the underlying area that I'm necessarily going to work. If their shoulders are hurting, we understand that they're experiencing some discomfort there, but there's some very phenomenal research that's coming into play over the last 2 or 3 years, particularly the last year, regarding chronic pain. This is something we're seeing very consistently, where a person will go to the doctor, they'll send them in for an X-ray or an MRI, and they'll get the MRI back, and lo and behold, the MRI will show that there's nothing there. The tissue, there's no tissue trauma, there's no tear, there's no lesions. Maybe there's a little bit of scar tissue, but in the big picture, what the patient is reporting as severe, debilitating pain doesn't correspond to what the image shows, which is that the tissues are actually really not that damaged at all, and they've healed if there has been an injury, or they don't really understand what's going on from the patient's perspective because the imaging shows there's nothing there. So that's another indication that where it is, it isn't. The person, again, is experiencing the pain in a specific spot, but we're really not seeing any long-term change. And our goal should be is that if we're working with our patients, we should be able to have them receive a treatment, and that treatment should be able to hold for a significant amount of time. And if it doesn't, that's an indicator that what we're doing maybe either isn't the right tool, and or something is happening in between the sessions that the patients are doing that's not allowing that to hold. So, so the video, there's a question, the video isn't working well. Can you state what is not working well in the video? Christine? Choppy. Is anyone else experiencing those same issues? Okay, so other people are reporting that they're not having the same problem. So my technical advisor is saying that you should log out and log back in and see if that addresses the issues. So, when we're close, it's better. Okay, so I'll scooch up a little bit and see if that makes a little bit of a difference. And we'll go from there and see if that helps with the choppiness. Okay. So the first concept that we really need to get when we're talking about where it is, it isn't, is that we have to understand that everything is completely connected. Via the fascial system, every nook and cranny of your body is connected, from the very outer layers to the very innermost core dynamics of our structure, is that everything is completely connected. We're at a point right now where we're going from a world as flat to a world as round change in regards to how we understand how the body functions. 1700th century anatomists, really did an amazing job with starting our infancy into understanding what's happening with the body in regards to, okay, there's an origin, there's an insertion, we have the muscle that connects from A to B, and then the muscle does this motion. Well, what we're starting to understand now is that there's certain parts of muscles that actually are staying relaxed and soft when the same part or another part of the muscle of the same muscle is engaging. And so what that does and what that lets us know is that everything is completely connected. If I have a tent pole, an old-fashioned Boy Scout tent where I have the tent pole in the middle, and then the canopy that comes out from the side to the bottom, and then the cables that hold that to the ground, if I pull one of those cables just a little bit too hard, that takes the tent pole and changes it to a different direction, and then that addresses and changes what the whole structure is doing. Now, what we understand with the body, particularly in the world of structural integration, is that that's exactly what's happening when we're talking about pains versus symptoms, and then where the problem is versus what the patients are reporting. So what kind of benefits are we going to see as we start to understand where it is it isn't? The biggest benefit is that you as a therapist, when you really understand where the problems are coming from the body, you're going to be able to make much quicker, faster changes with way less work. And if we think about it, you know, massage therapy, a lot of people give us a hard time thinking, oh, we have such a soft, easy job. But as all of you guys know, once you start working on 5, 6, 7 patients a day, which most people don't, the average amount of patients a day a person's working on is 3 to 4, is that the more changes that we can get with less work, we're going to see way more improvements for our patients, and that's going to have a pretty significant impact on what's going on for the patients for the long term. So the greater benefit you can apply in a short time period kind of goes against the whole Western model. The Western model wants people to come again and again and again and again, and I've worked at some pretty big clinics throughout the country, and what we've seen is that certain doctors and certain practitioners can get frustrated if you get someone well and then you send them on their way, because they're looking for that residual income of the patient coming in very consistently. And that's not what we want to do. What we want, what our belief is in our clinic, is that if we can get a patient well, get them to understand what's going on in their body, they're going to be able to make long-term change, which allows them to stay well. And we're not going to lose any revenue from people getting better. We're actually going to see an increase in our revenue. So one of the other benefits to really understanding how to address problems versus symptoms is that the happier the patients are, the more patients they're going to refer to you. So you may not see that same patient every week for the rest of their lives, but you're going to make up for that in the amount of referrals that are coming in. Because when you can take a patient that's been dealing with long-term chronic pain and you can get them back to functioning at a higher level, they're going to be pretty happy and they're going to start sending a lot more people in. So again, we have people who've been dealing with these chronic pains, and how many of you guys and gals have had patients that they've literally done everything? They've done massage therapy, they've done chiropractic care, they've done physical therapy, they've exercised, they've worked with a trainer, they've got together with a dietitian, they've had the surgery, they've been on the medications, and they're still dealing with a very significant amount of pain. That's exactly what our clientele is in our office, and it's something that we've been working with for 12 years. So what is the client's part to where it is it isn't? If we don't start with this next piece, which is the most important concept to the whole thing, the clients are never going to make any long-term change. And what the clients need to understand is that they have a very significant part in this process, is that what they're experiencing in their bodies in this very moment is exactly what they have created. Whether their bodies are overused, maybe they're triathletes and they're runners and they're putting on 100 miles a week. Maybe they play, you know, on 4 different softball teams. Maybe they have manufacturing jobs where they're working 70 to 80 hours a week and they're just overusing that body. That's a significant source of issues. The opposite of that is underuse. As we know, the majority of jobs in this country result in sedentary office work. We've seen such a huge transition of people being very active overall to now being very active in the big picture, especially in regards to sitting and watching TV. So people are spending 8, 9, 10 hours a day at their office, and they're going home, and on average in the States, they're watching between 5 to 6 hours of TV a night. So what happens is that body starts deteriorating, and they put themselves in certain structural positions, and then the body starts to adapt to that. Some of the new findings that have been found with fascia very recently is that fascia is the connective tissue that essentially keeps our whole structure together. If you were to take the fascia out of the body everything else would literally just fall apart. I like to compare it to a package of spaghetti noodles. We're going to use pens here for this example. So if I have the spaghetti noodles should be able to slide in and out independently on their own accord. Now what happens is that each of those spaghetti noodles is layered in an element of fascia. Then that group of muscle cells or nerve bundle or bones or ligaments are encased in their own layer of fascia. And what happens is when that fascia becomes very sticky, as the muscle tries to slide, it gets stuck and it can't go anywhere. So then the next step to that is that as that piece gets glued to the layer above or below it, next thing you know, while this is trying to move, it's tugging on all of the neighbors and the body doesn't move very well. And again, this happens from being underused, overused, and or if we experience an injury, which is a lot of the patients that we're working with. Automobile accidents, cycling accidents, there's, all of you guys have great examples of some pretty weird ones out there too. Had a patient who recently just fell off a ladder and broke his back doing chores around the house. So there's a myriad of issues in which we're dealing with, but the two biggest, and I think where we see the most problem experientially in our clinic is people who are underutilizing their structure. What we know about a fascial cell is that it has to be under a certain amount of load. If it's not being used, the cell actually turns into a perfect sphere and then it starts to disintegrate. And so then that causes damage and scarring of the surrounding areas. Next thing you know, everything gets stuck together so the body doesn't have any kind of differentiated motion. And the difference between a structure that's pain-free and light and easy and is fun to live in is a body that has a lot of space and mobility between all of the layers. And if we don't have that, we start to see all sorts of issues. So the client has to really understand that what they're doing with their body on a daily basis is what's going to determine what is going on within their structure. And again, we can see this. I have patients who are seeing a chiropractor 3 times a week. They're getting 3 one-hour massages a week. They're going to a PT 3 times a week. So they're getting 9-10 hours of therapy. So why are they not getting better? Again, there's something that's going on outside of the treatment sessions, and these practitioners are great. They're national level, they're world-renowned experts of what they do, but that patient is still having a hard time with chronic pain. So one of the things, the first step that I would encourage you to do in understanding where it isn't, is that we have to get our patients to acknowledge that there's something that they're doing in their lives that are causing those deviations and those gluing of the fascial layers. How are they sitting a certain way? Are they standing a certain way? Are they walking a certain way when they're at their job? Are they sitting in the computer all completely hunched over? There's so many examples, and we only have an hour tonight, so we're not going to get into all of them. But this is really the biggest piece. And what we found with the success that we have in our clinic is not the specific technique that I'm doing, so to say, is that it's the concept of once the patients start understanding what's going on, they can start to make the subtle changes to allow their body to come back to a more efficient state. An analogy, again, that I like, I love analogies, is that if I'm throwing rocks at a window and I break the window, but I just put up another window, but I'm still throwing the rocks, we're going to have issues for the rest of our lives. Maybe a person has had such a severe accident that they're not going to be able to stop throwing the rocks, but maybe we can change it from a brick, a big gigantic boulder, down to a little pebble that slows down or decreases how much pain they're in. As I'm sure you guys know, you work with patients who have pain, character-altering, debilitating pain. It ruins relationships. It separates people. It creates havoc in the household because someone is in so much physical pain that their mood, they're in severe depression, and the next thing you know, husband and wife stop connecting like they're supposed to. Relationships between parents and children, a mom or a dad can't go to the soccer game or can't go to the swim meet because they're in so much pain. So that really is a big piece, is understanding what's going on with your patients. So how do we get our patients to start doing the detective work at home? It's the simple things that make the most amount of change. For some of you, you're going to hear some of these concepts and say, well, of course I know that. Of course that's so simple. And if that's true, then that's fantastic, but why are our patients still having such a hard time? So we like to start with the basics, is that what are our patients doing consistently on a daily basis? Are they walking? Are they getting any kind of exercise? Or are they sedentary? Are they sitting? If they have an active job, such as construction, or let's say they're a delivery person, they're a mechanic, they are very active, they are very busy, what things are they doing consistently? If we're working on a mechanic who's staring up at the undercarriage of a car, working on the bottom of an engine while the car is on the lift, what kinds of things are they doing there that are going to have a significant impact on that cervical vertebrae, on the low back? There's all sorts of things that are going on in that dynamic. So if we want the grass to be green, all we need to do is water it for 10 minutes a day, once a day, and we're going to have a nice green lush yard versus a yard that's starting to deteriorate. And the body's exactly that same way. So I would encourage you to go through with them in detail a consultation where you're asking them, what are your activities? What is your diet like? Now, it's in the state of Washington, which is where we live, it's out of our scope of practice to advise on anything that pertains to the ingestion of any kind of a supplement or food. So when I ask them what they're doing with their diet, all that does for me is that gives me an idea. Are they deficient on calories? Are they excessive on calories? Maybe they're eating food, but they're not getting enough of the right nutrients for the body to repair itself. So once I have an idea of what they're doing or not doing with their body, I can send them to the right referral source. We can have them work with a dietitian who's going to be able to get them back on track. Maybe your client reports that they're having a really hard time in their marriage, or they're experiencing a lot of depression. And again, in most states, it's out of our scope of practice to counsel, but we can refer them to a mental health practitioner who's going to be able to help get them on track and help combine those tools together, where you can do the physical manipulation of the tissues and whatever it is that you do and your specialty is, and then the mental health practitioner can help work with their mental emotional state. And then when we see those things start changing, we're going to start to see a transition in chronic pain. One of the things that our clients come into our office, they say they like the most, is that when they come in for their first appointment, is that I sit down and I go through the intake form with them. I know I've been to many doctors' offices where they give me a 3-page form that has 1,000 boxes that I have to read through and check, and then they give that to the doctor, and the doctor doesn't even really look at that in detail oftentimes, or the massage therapist will circle the areas that you're hurting. That doesn't really quantify what's going on. All that does is gives you an indicator of where they're experiencing pain. But remember what we said about our clients don't always understand what's going on in their body. And just because they say they hurt in their shoulder, right, at this point, doesn't mean that that's where the problem is coming from. So it's really important that we have the opportunity. We're spending an hour with them at a time, that we can sit and connect with them and engage them in conversation, and we can really start to do the detective work to figure out what's really going on in their life versus the story that they've created. How many of you guys have had the situation where your client writes down no injuries, and then as you start working with them in the session, they say, oh yeah, 5 years ago I was in this auto accident, or 10 years ago I fell off of a pole that was 10 feet in the air. All of those are clues as to how the body has to adjust and compensate to any kind of damage that's been done to it. And oftentimes patients, they forget. When we're in pain, we want to move on beyond that. And so it's very easy for our patients to get in a place where they don't even remember all of the injuries and the issues that they've gone through or they're experiencing. So when you take that moment to connect with them, and you sit down and you ask them questions specifically, that really gives you a very special opportunity to, one, to develop a relationship, which is going to allow you to be in a place with them that very few other medical professionals will take the time to do, because they got to see so many patients. And two, it's going to help them spark some things that maybe they forgot about, that can be exactly where the problem is coming from and not just the painful area. So that first step is we really have to get them to be accountable to what they're doing outside of our therapy sessions, and start to do the detective work to figure out where the pain is coming from. Say I have a patient who comes in and reports, I get the MRI report and it says herniated and bulging discs in L3, 4, and 5. I care that that's there, but why are the bulging discs happening? Why is the deterioration in the vertebrae happening? That's the next question that we need to ask is, where is it coming from? Why are they having a hard time? You know, I'm experiencing pain in my neck when I do too much computer time, or if I'm golfing, or if I'm playing with my kids, all of a sudden I get some low back pain. That's fantastic, but where is that coming from? And that's going to bring us to the next step, which is the physiological piece. So we have the clients starting to think about where the things are coming from, maybe where their issues have stemmed from or why they've developed. Now we're going to transition into our specialty, which is being able to manipulate the soft tissue, and or if you're a Reiki practitioner or a craniosacral practitioner, as we transition into the energetic work. And we all have to acknowledge that everything is just energy. If we want to be scientific about it, we can say, you know, blood cells, ligaments, bones, tendons, what are they made of? They're made of electrons and protons that form atoms. So technically, everything is just energy, and it all has a vibration. And we understand when that energy starts to get stagnant, let's say we have tissue that gets torn, there's stagnation in that area of energy, and if we're a PT or a chiropractor, the doctor's going to diagnose a lesion of the biceps femoris, and we're going to understand as therapists that there's more things going on there than just the tear. We're going to have the nerve issues, the story to the brain on what's happening in that area is going to be different than what it was before. So the beautiful thing about where it isn't, is that it doesn't discriminate with what kind of therapy that you specialize in. My specialty is the Rolf method of structural integration. So much so that we have a school. We're one of 20 schools that are recognized by the International Association of Structural Integrators as being approved to teach the Rolf method of structural integration. Massage therapy was great. I have friends that specialize in Reiki. I have friends that specialize in Shiatsu or Lomi Lomi, lymphatic drainage, trigger point therapy, medical massage. There's so many different modalities out there. But what I want you to understand is that whatever your specialty is, when you apply this concept of where it isn't, it's not going to matter what you do. The other beautiful part in the fact that this doesn't discriminate is that it doesn't matter what kind of patient you're working with. If you have a patient who is old, if they're young, if they're super active, if they're extremely inactive, if they're a high-level athlete, we work on a huge amount of Olympic and professional athletes. I'm on the medical team for Division I colleges. It doesn't matter. You can have your stay-at-home mom who loves to take care of her kids, or you can have the cyclist that rides 200 miles a week. Your specialty is going to be able to help them no matter what. So how do we understand where it isn't in regards to the body? So as we understand that everything is connected, we need to look at the structure of the body and where the body should be. So how do we know if a body is more balanced or less balanced? It's pretty simple. We're going to use two very, very simple tools. We're going to use a horizontal or a vertical line, and we're going to use a horizontal line. And what happens is that when we look at the body, there are certain points in the body that should be perfectly horizontal, or there's areas of the body that should be perfectly vertical. And we're going to go through some pictures here in a minute with some patients and show you what happens when those pieces and parts aren't in line. So if we just look at my shoulder girdle, for example, if my left shoulder is higher than my right shoulder, what happens is that I'm going to start experiencing some kind of typically neck pain. But oftentimes, we're going to have pain in other areas of the body due to compensation. Because remember, everything is completely connected and locked and woven together. So as a patient is standing before you and they say, I'm having all sorts of migraines and neck pain, as we look at that, where is the problem coming from? Now, the patients have reported that the pain is in the left cervical spine, but is that where it's stemming from, or is that the condition of a tight neck? Or is that a condition from a tight rib cage pulling the right shoulder down, which then elevates the left shoulder? Those are the things that we need to think about. So the question that I asked you earlier at the very beginning is that where are the most common areas of pain in your clients? How many of your patients state that they have pain on the front of their neck? How many of your patients state that they have pain on the front of their chest? How many of your patients state that they have pain in the abdomen? Most patients, what we found through our research in our clinic with hundreds and hundreds and hundreds of patients, is that the majority of the pain areas that our patients report is on the posterior surface of the body. everything back here. Almost all of our patients report the back of the neck, the upper back and shoulders. Oh, I carry all of my tension in my shoulders. I carry all of my tension in my back, which is true. There's a very significant amount of tension going on in the back, but that may not necessarily be where the problem is from. That's where they're experiencing the pain. So here's the next step. A person goes to the massage therapist. The massage therapist, on average, puts them face down on the table, and they spend 25, 30, 40 minutes even working solely on the back. So a patient comes to you, and they report that my head and my neck are hurting. They report that their shoulders are hurting and that their low back is hurting. So all of that tissue is stretched out and it's elongated. And then the average therapist is going to work on that person for the next hour, 30, 40, 50 minutes, face down. I know I've heard this tons of times. Can you please just spend the entire hour on my neck and my back? So then the next week when they come in, they say, I felt better for a day or two. And then by about Wednesday, I was back to square one, and I have excruciating headaches, and I have a knife digging into the back of my shoulder blades. So you do a session, they feel really great for 2 or 3 days again, and then they're right back to it. And that's that cycle that we see with consistent chronic pain. So what is going on within the structure? Here's the thing that I really, if you get this one concept, then it's going to change your practice forever. I've been teaching for 12 years, and the most common statement that we get from our students is that when they really start to apply these techniques of working the short cables versus long cables, all of a sudden their patients they had been working with for 15, 20 years got better at a level that they had never achieved before that. So if I'm looking at a patient, let's say we're looking at the patient from the side, and the head is forward and the shoulders are rounded, which is most people, they look like driving, maybe sitting at a computer all day long, or if I'm sitting at home and I'm sitting on the couch, we can see all this tissue rounds forward. But where do we spend the majority of the time in the session? On the back. What we need to start thinking about is that the short cables, if I look from left to right, is that the short cables are actually on the front side of the body, pulling all of this forward and down. It's not until I get this to open up in the front, which will allow the shoulders to settle back, which will allow the head to come back into its more ideal position. And all of a sudden, those cables that were all stretched out and they were holding on for dear life, and as they were holding on, they were pinching on all the nervous tissue, they were decreasing the size of the vasculature, so not enough blood was getting through the tubes, and so healing wasn't happening. They were actually getting worse. And what we didn't know inadvertently as therapists is that the more that I work that long tissue and I make it even longer, I'm actually increasing the client's problems. I'm making it so much worse than what I could ever imagine. So in your sessions, as you can start to look at the short areas of the short cables, where they're rounded and where things are tight, and how many people will comment, oh, my pecs are just so tender. All you have to do is barely touch it, and it's very, very sore. But you could dig like crazy on the back. And that's because, again, that tissue was too elongated on the back, and the front tissue is too short. Let's come to low back pain. This is going to be something that's very similar. Is that if we're dealing with low back pain, and if I turn to the side, and my pelvis is supposed to be more level if we look at my belt line, but all of a sudden my pelvis is sitting in this position, we can see that it's more forward in the front and it's tilted down and it's up in the back. So let's think about hamstrings. You are having issues in the hamstrings where the patients are stretching their hamstrings and they're stretching their hamstrings, but guess what? The hamstrings are already too darn long, and we stretch them, make them even longer. So what the quads do on the front is the quads start to shorten up, and then they get stuck in that position because that's what you're doing with the body. So when we're dealing with hip pain, low back pain, if we can get those quads to elongate in the front through here, all of a sudden that pelvis can come back to level, the low back gets to open up, and the hamstrings can soften. Imagine if you were playing tug-of-war and you're tugging and tugging and tugging and tugging and you're contracting and you're working, and then the other end is tied to something that's fixed and it starts to stretch out. The tear is going to happen in the tissues that are starting to elongate and they're starting to fray. they're not necessarily going to tear where the pole is coming from. So that short tissue in the front, the pecs are shortened, but the levator, the erectors, the rhomboids, those poor scapulas go wide, and then the next thing you know, they're screaming because they're trying to hold on as everything's rounded. So what we're going to do now is I'm going to transition to some before and after pictures. We're going to take you through some pictures and show you some of the areas where the cables are short versus where the cables are long, so you can start to see that this is not me just making this information up. This is clinically oriented. We have, the proof is in the pudding of the imaging, and we're just going to get to see some pretty amazing pictures coming up here. So hold on just 1 second. Okay, so what we have here is a young man who is 15 years old, and as we look at this structure, we're going to point out some of the deviations that we see within his body. If we look at his right side compared to his left side, we can see that the young man has a very significant amount of scoliosing. His right ASIS is much higher than his left. So again, if we use this is why we have the grid, we can see our vertical lines and our horizontal lines. And if we were to draw a horizontal line across his ASIS, we can see that there's a pretty significant between the two in their horizontality. Look at the shape of his torso and his trunk between the arm and the trunk. This left side has a lot of space as the arm is hanging with the line of gravity, but this right side is very compressed. What's been interesting is that this young man, his clavicles are rounded a little bit, but not one shoulder is that much higher than the other. His right hip is much higher, and the left shoulder is a little bit higher. So this was before the first session when I worked with him last week. We're going to come to the next slide, which is after the second session. So this is before we've done any work with him. And we're going to come to the next picture. And I know there's going to be a little bit of lag time for you guys, so I'm going to wait up just a little bit so that catches up. So now as we're into the second picture, compared to the first, you can see the horizontality of the pelvis is much more level. The right hip is nowhere nearly as high as his left hip. We can see the shoulders. That left shoulder still wants to be a little bit high, but look at how much closer his left arm is to his left side compared to that first picture. And again, and the S-shaping or the scoliosing of his spine, because remember, everything's connected. So as we're looking at this young man's structure, the front is just the front of the back. The back is just the back of the front. But so few practitioners think in that concept. They just get connected and they get their tunnel vision on and they think about, okay, I'm going to work and work and work the shoulder where they're experiencing the pain, but that's not necessarily where the problem is from. Now, what's interesting with what I did with this young man was we did just a little bit of work on his spine through here, and we actually spent a huge amount of time working through his legs. If we go back to this first picture, we can see that that pelvis is crooked. And where do you think he's experiencing the most amount of pain? He's experiencing the most amount of pain in his low back and up through his mid-back. But the work was applied to his legs and his feet because this left arch through here was completely collapsed, falling into the ground, which was causing that left hip to fall down, and then the body was compensating so that right side was contracting even more. So as we come back to the second picture, we can see now that the legs are much more even to each other and those hips are much more level. So again, I spent more time working on his legs to start to address the low back than actually working on the low back itself. So there's an example of where it isn't. His pain was in his low and mid back, but the problem is not only coming from where he's experiencing his pain. We're going to come to the picture from his side. So again, because of the scoliosing, we can see a significant amount of curve in his low back. I should wait just a second. I know that's a little slow for you guys in its delay. So here, as we look at his low back, we can see there's a significant amount of lordosing happening. We can also see the right side of his low back. If we're looking at a patient from the side view, I shouldn't be able to see their right side if their left side is presented to me. Another thing that we're going to see in just a second is the rounding of his abdomen. He's a basketball player. He plays 4 or 5 days a week for 2 hours a day, so he's in great shape, working on becoming a basketball star. He's very phenomenal. But as we transition to after our second treatment, look at the change, as it's going to come up in just a second. Look at the change of his abdomen. As we look at his abdomen, look at how much more flat that is. As we come to his low back, now we can see that we have lesser of a lordotic curve, and I can't see his right side at all. I just see much more of a straight shot through, which is how that picture should be. So if we're going to go back to the first session, we can see again, look at that elbow covering most of the back, much more lordotic curve through here. That pelvis is fairly severely anteriorly tilted, and then the abdomen is rounded, because that lordotic curve, what that does is that starts to push the spine into the body, so the organs have to round forward and out because there's no room for them. As that spine starts to come out of the body, all of a sudden, as we come back to our second session, we can see his abdomen will flatten out as that lumbar curve is less in its severity. As we come to the next picture, sorry, some technical difficulties here. As we come to the next picture, this is a gentleman who, if we could guess where his pain was, what do you think you would all say? We would say a significant amount of pain. Yep, you're right, in the cervical spine. You can see how rounded his shoulders are. Dowager's hump, or hunchback is what our patients oftentimes call it. A very, very rounded thoracic spine. And so he was seeing therapists. He was seeing massage therapists, chiropractic care consistently, and it would feel better for a day or two, but he would be right back to square one. So we can see, if we were to look at our vertical line, we start from the ground and we work our way up. Here's our malleoli. We come and we see the center of the knee is forward, the hip is forward, the shoulder is forward, and the ear is even more forward over the shoulder. So this poor guy's head is over his toes, which are not designed to support the weight of the body. So again, look at how severe and significant this kyphosing is, and then the contracture through his cervical spine, severe migraines, debilitating pain where he was averaging a day a week out of work, which was putting his job in jeopardy, because let's face it, most people in America can't miss too much work without being replaced. So we're going to go to after our 10th session, and we're going to see a very significant change in his overall everything. So as we come to his head, we can see that his head is much more over the shoulders are over the hips are over the knees, and the knees are over the ankles. So what this does is this allows the body to be more soft and neutral, as opposed to being so contracted. Because again, as he was very far forward, all of that tissue on the back side of his body, all of that posterior musculature and fascia was getting stretched out, and then it was holding on for dear life. And then the front tissue was shortening up. So in this whole process that we worked with this gentleman, each session we only spent about 5 to 10 minutes working on his back, and rest of the time was spent working on the anterior surface of his body. Now, I'm not saying that you have to do that, because again, your treatment protocols will be a little bit different based on your specialties, but with the Rolf method of structural integration, what Ida discovered was that the work doesn't have to be, and it shouldn't be, focused on where the cables are too long. Okay. All right, so now as we're to the next sets of slides, we're going to look at this gal in the gray. She is a dystonic patient. Dystonia is a neurological disorder in which the message is into the brain, so what the body is telling the brain is not correct. And then the brain then responds with not sure what it's supposed to do. It causes significant contractures and tremoring and shaking. So many patients who have dystonia are actually diagnosed with Parkinson's because they look very similar to each other. So we can see in this first picture, if we look at her waistline through here, we can see her left trunk is very contracted, and it's actually pulling the shoulders over to her left side. So the body's compensation to that is coming up into the right cervical spine. We can see that her right head is very severely tilted. Now, this was not her just standing in that position, making herself be there. It was she had no control over this. The dystonia was contracting and causing the muscles to go into spasm and severe hypertonicity to pull her out of where she needed to be. The young lady on the left-hand side or on the right-hand side of the screen with the purple top, we can see as we look at the shoulders that that left shoulder is much higher than the right. But again, where is that deviation coming from? Her pain, if you guess, is probably in the cervical spine, which was absolutely true. But what we found was that she had a huge amount of contracture through her right torso. So this was pulling the right shoulder down, and it wasn't so much what was going on her left side, which is where all of the other therapists were focusing. So again, if we look at the short cables and decide where try to figure out and do the detective work of where the pain is coming from. Let's say you have someone like this that comes into your office and you work the first session in her neck and she comes back the next week and there's no change. Don't just go right back to that same area because you were already there and it didn't really make much change. Look at the horizontals and verticals and maybe try another area. So if the shoulders are low on one side or high on one side, is it being pulled up or is it being pulled down? So something to think about. As we come to the next slide, here's another young woman. Her reported symptoms were severe neck pain and migraines, severe shoulder pain, as well as severe low back pain and knee pain. This young woman was 19 years old when I was working with her and was at a point to where she was working on filing disability claims because her pain was so severe that it was hard for her to go to work for even 2 or 3 hours at a time. So here we can see this neck and shoulders. Again, that left shoulder is elevated. The feet and the ankles, if we compare them from the first picture to the second picture, we can see that they're very different. The clavicles are much more horizontal. If you look at her head in relationship to the picture in this first picture to the second, you can see the shape of her neck is very different. But again, we spent very little time working on her back and more time working on the front of her body. Because again, the cables on the front side were shortened and compressed down, and the cables on the back side were too elongated. So again, where her pain is isn't necessarily where the problems are at. As we come to our next picture here, we're going to see that this was a 7-year-old boy who was participating in martial arts and soccer. His knee pain was so severe that he was at a point to where he was having to quit his sports because he couldn't even be in practice or in his training sessions at the karate studio for more than 10-15 minutes at a time without the pain being very excruciating. So as we come into looking at, this is the first session that we worked with him, the beginning, this first picture with the green shirt, we can see that his feet have completely fallen and collapsed. There's no support within the arches. We can see the knees are very knock-kneed, and there's a lot of stress and pain going on in this picture. This picture was taken, we did 5 sessions with him at about 15-20 minutes at a time, but the key was we didn't spend the whole time working his feet. We spent the most amount of time working his lower legs because the foot position is completely determined by the muscles of the lower leg. Just like if you move your hand, moving your fingers, opening and closing your hand isn't a result of the muscles in the hand, it's a result of the muscles in the forearm and what's going on here. So as we start to organize the muscles in the leg, all of a sudden we can start to see a significant change in his feet. And then as we come to this picture was the little boy 9 months later with no more work. What we did was, after we worked with him, 3 or 4 or 5 sessions, each session, session 3, session 4, session 5, third, fourth, fifth treatment, we started working with him on how he was supposed to walk, how he was supposed to stand, and what that did over the next 8 or 9 months was allowed his legs to continue to change to where now we have much straighter legs, we have the feet that have arches in them, and his pain was completely gone, 100% resolved, and he was at a point where he was having to quit his athletics. This is one of my most favorite pictures. This is going to be explaining so much low back pain. So as we're in this next picture, and hopefully your screens are catching up, we look at the picture on the left-hand side of the screen. And if we look at her waistline, we can see her waistline is almost a 45-degree angle. What that means is that there is a massive amount of compression in her lumbar spine, severe low back pain. There was so much deviation in her structure here that she was actually having infertility issues. Her cycle was all over the place because the internal pieces and parts of her reproductive system, her digestive system, couldn't work properly because of the severity of the deviation within her pelvis. So as we come up to the head and the neck, because everything is connected, when that waistline and that pelvis is not level or straight, the head and the neck then start becoming compressed, and they're compensating because everything's connected. So as we come to this picture on the right, again, same thing. We spent very little time working her overall back, and we spent more time working the front side of her body. So we can see the pelvis is much more level. We can see that low back has much more space. And look at how different her head and neck are versus this first picture where everything is squished. Look at the waistline, how much more flat the abdomen is. Look at how rounded the abdomen is here. So where do we think this problem is coming from? Again, her pain was severe low back pain and severe neck pain, cervical pain, migraines, as well as thoracic outlet syndrome, where she was having tingling and numbness. She was dropping things because there was so much compression through her cervical spine and thoracic spine. So remember what we talked about, the hamstrings being too long? If we connect the hamstrings here and we connect the quads here, we can see the quads are very contracted and shortened, and these hamstrings are so stretched out that they just can't hold on anymore. But she was also having a significant hamstring pain as well. And so as we started working with her, each session we were spending more time on the front than what we were on the back, and we were working the backside, but in about a 2-to-1 ratio. And then all of a sudden, look at this immense amount of change with her structure in this second picture versus the first picture. So again, where it is, it isn't. And oftentimes where the patient is telling you their pain is, that's the symptom of the body not working properly, and that's where it's expressing itself, but that's not always where the problem was. So we worked more on her quads and more on the front side of her body than we did on the back to produce these significant changes. And again, no discrimination on the kind of therapy you do. You can do energy work, you can do Swedish massage, you can do trigger point, and if you spend more time on the shortened cables than on the long cables, you're going to get more bang for the buck. We're traveling nationally sharing this work that we're doing. This is just a tiny, tiny piece. It's not even a tip of the iceberg on the information that we have in regards to being able to treat significant, severe, long-term issues. Now, the beautiful thing is that maybe your practice doesn't consist of chronic pain. So if this work works so well for chronic pain patients and people who are having a hard time, imagine what it will do for people who are more healthy and are looking for just overall improvement, even if they're not experiencing pain. Again, we work with so many professional athletes, young kids, we work with people who are older. It doesn't matter if they're severe or if they're mild in their discomfort. What we know is that starting to apply these concepts, it produces such a massive amount of change in such a short time period that it's pretty remarkable. Again, we're dealing with people who've been to the worst of the worst in regards to how bad they're hurting. So we're traveling all over the country. Our website is going to have a list of the upcoming classes. There's going to be a lot more classes coming up. Not all of them are on the website, as we're still getting a lot of requests to go all over the nation and actually internationally as well. One of the things that we're offering you guys for you spending your time with us this Friday evening is that if you sign up for a class, one, we have an early bird registration special where if you sign up for the class a month before the start date, you get a $50 discount. And then we're also going to offer you, as a thank you for spending your evening with us, another $25 discount if you sign up by Sunday evening at 12 p.m. Which is going to be a $75 total discount in regards to the upcoming classes. There's a great amount of information in regards to what we do teach and what our specialty is. If you want to shoot me an email and ask me any specific questions in regards to patients and conditions that you're trying to address and treat, and maybe they've been a little tricky, I'd love to do that. This is my passion. My passion is to help people. My dream is to be able to teach people to help more people. And again, thank you very much for your time tonight. The code to be able, it's webinar. So if you go to the website and you click on register and you type in promotional code webinar, that will give you that $25 discount for spending your guys' time with us this evening as a special thank you. So we're about 6 o'clock. We're at our hour. I hope you guys have a wonderful night. Have a great weekend. And thank you very much for spending your evening with me. If you have any questions, give us a buzz. Thank you so much.